Hi, my name is Mike Blake. I want to spend a couple of minutes with you and talk to you about a fantastic drug called Increlex. It's made by Ipsen Pharmaceutical, and it is utilized in the treatment of IGFD, or insulin growth factor deficiency. Now, IGFD is diagnosed primarily in young children under the age of 2 once it's discovered that they have stopped growing. And it's different from having a deficiency in just a growth hormone because there are different kinds of growth hormones in our bodies. There's the traditional, just the GH growth hormone that we know and heard of a lot. And that can also be in short supply and cause lack of growth. But this primarily lack of growth that we're seeing is IGF-1, which is another growth hormone that's synthesized in the liver. And just to give you some background, growth hormone is produced in the pituitary gland at the base of the brain. The growth hormone travels the body, and then when it does reach the liver, it stimulates the liver to make a second growth hormone called IGF-1. Now, the binding of IGF-1 to its receptors is responsible for all kinds of body growth, which includes increased protein synthesis, cell growth, cartilage growth, muscle growth, skeletal growth, and other systems growths as well. Now, children with normal growth hormone levels, exceptionally low IGF-1 levels, have a condition called IGFD, or insulin growth factor deficiency. And those are the differences between the two. There's a terrific organization out there that really helps get the word out about IGFD and its cause and effect and its treatment. And that organization is called the Magic Foundation. How it was discovered in our son, he obviously wasn't 2, he actually was 12. He is a type 1 diabetic, and this particular malfunction of the production of IGF-1 happens very rarely in a very low percentage of type 1 diabetics, and during a routine visit we discovered that he wasn't growing, and I'll show you some before pictures. Then also an after picture of him once he got on Ipsen's drug called Increlex. And let me tell you, I'm not a paid endorser for Ipsen, but this has been a miraculous drug for him and for our family. It has benefited him, as you can see, physically, but also emotionally and cognitively. His grades have gone up, so it's been a tremendous drug for him with very little side effect. So I'm a very strong proponent of this, and this is probably the primary reason why I'm actually doing this video, is to try to get the word out about this particular drug and its effect, very positive effect it's had on our son and also just in our family, and that effect it can have for other children that have IGFD. I hope this has been an informative and beneficial video, and feel free to email me or with any kind of comments or questions, or you can also see me as a frequent blogger or commenter on the Magic Foundation's Facebook site. Thanks again.